Well, hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I'm here today talking to Dr. Lenora Marcellus about her upcoming presentation for the Gold Neonatal Online Conference. Welcome, Lenora.
Thanks for having me.
It's wonderful to have you back here at
Mhm.
Gold. And you are presenting on a very important topic this year. And the title is Supporting Adolescent and Young Parents in the NICU Setting. Very important here. This is, as I mentioned, part of the Gold Neonatal Conference. So before we get started, tell us a little bit about yourself. You're a professor of nursing and you have spent many years as a nurse at the bedside as well. So just give us a brief overview of your journey.
Sure. Well, I have been a nurse for a very long time now. It's this year's actually the 40th anniversary of graduating from my nursing diploma program. And during my diploma, I actually spent one of my final practicums in the NICU and realized that was where I wanted to spend my career. So upon graduation, I did take a specialty program and then started working in the neonatal unit in a couple different provinces here in Canada. And most of my practice and research has all been to do with mothers and babies during that time. And I'm particularly interested in supporting young parents and families. I volunteered for many years with a community-based group here in Victoria called Mums and Mentors, where we supported young parents in the community. And I've been part of a long-term research project here in British Columbia, where we implemented the Nurse Family Partnership Program across the province, which is an intervention for young first-time low-income moms and to support them and their families with really strong starts. So very interested in supporting this group of families who often have a little bit of a tougher time because they can face some judgment from their care providers.
Right, right. Yeah, I mean, it's amazing the work you're doing there for the community, all the research you're doing as well, and supporting these families is absolutely beautiful. And as you just mentioned, there are unique. I mean, having a baby in the NICU is difficult to say the least for any family, right? But I can also imagine that there are unique challenges for these adolescents and very young parents as well. Can you talk about that a little bit?
Sure. And again, one thing we will talk about during the when we meet formally for the whole discussion is that there's a lot of variability depending where you live. So hopefully we'll be hearing where you're from, because the policy environment, how you accept, is it great to be a young parent or not great to be a young parent? But certainly probably one of the biggest issues too is just that whole issue of determinants of health. And where are you living? Do you have the resources to live well? So a lot of younger families may or may not have relationships with their own families and have the resources to parent the way they want to parent. And also, we'll talk a little bit about all the newer brain science about evolving brains and
Ooh.
how that comes into play as far as what you're able to bring to your parenting situation.
Oh, that's juicy. I have to say, that's really
Mm.
good stuff there, brain development. I'm looking forward to that very much. And another thing is also stigma, right? Adolescents or
Mm.
young parents, they face a lot of discrimination, a lot of judgment. You mentioned that yourself too. So how can healthcare providers be trained or do, check their own biases as well? So talk to me a little bit about that.
Sure. And I think this is part of the broader conversation about inclusivity in our practice. And we're, I think, spending a lot of time thinking about biases, whether it's related to racism
Hmm.
or different types of isms when we're working with families. And so age is another, and I'd say that we have an ism for older parents too. And so to step back from what we think people's capabilities are strictly related on an age basis to just bring ourselves relationally to our care with families.
Wonderful. Thank you for that. Another area that I can see might be challenging is communication, right? I mean, we know, I mean, there's a huge difference how generations communicate. And if I look at my daughters, I have teenage daughters. Sometimes it is like they're speaking a completely different language, right? If they're talking to their peers. So how can we reach these young people, these young parents in a way that it makes sense to them in a way that it really, we communicate effectively with them?
Mm-hmm. And there's some really great in the youth literature. There's a lot to draw on, and often in perinatal and neonatal nursing, we're not necessarily looking at youth health literature. So there's
Mhm.
actually lots of work that's been done in partnership with youth on how to work with us so that we don't want to be talked down to. We want to
Mhm.
be collaborating with. We're parents. These are our babies, and we want to know what's going on. So very much those kind of same issues. There's ways of communicating, so really engaging with technology
Mhm.
to be in touch and sharing information. This is a great place to have maybe an advisory group for your unit and think about, why don't we engage with some young parents to hear about how they found care in our unit, and what would you have
Yeah.
suggestions for us?
Oh, that's brilliant. That's really good. Hear from them, seeing like, get them involved and give feedback, or listen to them. What do they need? What do they, hope for, or what communication style works best for them as well, right? Now to some, a concern of ethics. We, in the NICU, often very difficult decisions have to be made. And, if the parent is not, let's say, an adult themselves, from a legal age, is that something we also have to take into consideration as well, for the staff? I can imagine there's sometimes situations where the staff goes straight to the grandparents and says, listen, we need to do XYZ, and completely kind of, um, because finding that, oh, the young parents are not able to make these kind of decisions effectively. Have you seen that? What kind of considerations do we have to look into there?
Yeah, certainly. And of course, it's layered with other considerations for different cultural groups, and
Yeah.
different state policies and state legislations can be different. And so this is definitely one area where you want to know where you live and what those policy implications are. And probably a suggestion here would be, instead of waiting for that moment to come
Hmm.
and having that decision making in that complex moment, is to anticipate that you are going to have younger parents in your unit, and these issues will come up, and have that conversation with your ethics department or your legal department. So you've already been doing a little bit of simulation, so to speak, as far
Hmm.
as what we might need to do to be a little bit proactive there.
Yeah, proactive. That's a really good advice right there. Now, Lenora, before I let you go, any last words of wisdom for our viewers that you're hoping that they will gain from your presentation?
Probably that this is another group of parents who wants to do really well for their
Mhm.
children, and want to be treated as such. And so to bring ourselves as fully to that relationship as we can.
Beautiful. Well, thank you so very much, Dr. Lenora Marcellus, for sitting down here with me and talking, first of all, about the wonderful work you're doing in your community, all the research, and now also about this presentation. It was a pleasure hosting you here today.
Thanks, Kristen.
And for our viewers now, if you're interested in this presentation supporting adolescents and young parents in the NICU setting, and all the other presentations of the conference, we invite you to visit goldneonatal.com for more information. June 3rd, we get started with our free open access keynote presentation by Dr. Niels Bergman on skin to skin. And it's something that you don't want to miss out on. So check the website, make sure you're joining us for the opening keynote, and of course, the rest of the conference. So we hope to see everyone at the conference. Bye-bye, everyone.